Hi friends, this is Dr. Abdequaem from Grace Healing Homoeopathy. Today I'll discuss the remedy Chelidonium majus. Chelidonium majus, as you all know, is a very interesting remedy and routinely prescribed for liver disorders, for jaundice. Today I'll share a very interesting case in relation to mental symptoms of Chelidonium. I had a case where the patient coming to me just was telling one symptom every time that, sir, I've done something so wrong in my life, and I don't think that God will ever, pardon me for that. And I have lost that hope that I will be pardoned for my sins, and now what will I do? Here also I'm unhappy, and there also after death I'll be unhappy. So what should I tell you? I have no desire to live. I have no desire to talk to people. He was staying at home, absolutely a state of depression. And we asked the symptom, and he said a lot of things, and this symptom was very prominent in that. And he said, because of that, I am always anxious. What will happen? What will happen? What will happen? And because of anxiety, there's a lot of palpitation. There's a lot of palpitation. As I always say, anxiety is such a common psoriatic symptom. You have to understand how the patient reacts when he becomes anxious. Chelidonium has palpitations. Some patients may have trembling. Some patient may have, twisting of eyes. Some patient may have increased urination. And also one thing, because of anxiety, there's a lot of pain in the chest because he feels that he has done something else, and that also causes anxiety. That if I suffer from heart disease, what will happen? And continuous anxiety. So anxiety from pain in the chest also is also Chelidonium. And because of that anxiety, and because of that, restlessness mentally, that he feels that he's so anxious that he has done something wrong which cannot be pardoned, he starts suffering from loss of memory. So much so that it is written in our books that weakness of memory, he does shaving and he forgets that half shaving has been left around. It is just to show the gravity of that memory weakness. It's not only shaving, it can be anything, or you can say, he puts one of the stockings and he forgets to put the other part of stocking. So it is just to show the gravity of loss of weakness of memory the patient is suffering from. So don't always ask the patient whether when he shaves, he forgets the half part to shave. It's not like that. It's the gravity of the memory loss. I have found the basic symptom is that anxiety, that of conscience, that he has done some unpardonable sin. And because of this restlessness, that constant restlessness, constant anxiety, he's so anxious, he's so restless that he finds no enjoyment in anything. He finds no rest in anything. That's a very interesting case which I have seen, and I prescribed the patient Chelidonium 1M. After again 15 days, I repeated. I think I repeated Chelidonium thrice in a span of about 6 to 8 months, and he was out of it. Then he came to me and told, sir, I don't think that the sin was so severe and I was feeling the gravity so severe. But now I'm feeling happy. I have gone and I have done everything what I could do, and he was living a happy life. The symptom that you should understand in Chelidonium is anxiety of conscience, feel that he has done some unpardonable sin, anxiety with palpitation, anxiety from pain in the chest, weakness of memory, forgets the half part of shaving, and weakness of memory, feels that he has lost one of the stockings or he has not worn that stocking. Restlessness, anxious, finds no rest in any employment, or restlessness finds rest nowhere at any employment, you can say. That's a symptom given in Mental Rubrics. One symptom I just want to share. I had a case of kidney disorders. The patient was suffering from severe kidney infection for the past about 10 to 15 years. She had taken a lot of medicines but with no avail. And she said that whenever the infection increases, there is so burning, there's so increased frequent urination that she just slips into fainting. She faints and she just becomes unconscious. So there's a symptom in Chelidonium, unconsciousness coma after kidney disease. And again, Chelidonium in LM potency, I repeated from 0/3, 0/5, and the patient was cured. She followed up for 1.5 years, and for 1.5 years, no recurrence of that severe UTI. So my dear friends, this is a very interesting case of Chelidonium which I wanted to share. And if you like this video, do share and subscribe. Thank you.